Welcome to another episode of MK Crypto Diaries. I am your host, Dr. Justine Scerri Herrera, and we are pre-recording today's episode on the 21st of February 2023. Today, we will be discussing Web3 and blockchain in the healthcare space. How can players leverage blockchain and Web3 for hospitals, healthcare, and medical data? More importantly, why would one do so, and what benefits does blockchain provide to this industry? Joining us for the conversation today, we have the wonderful Georgina Kyriakoudes. Georgina has been leading Web3 projects in the healthcare space since 2018. Her background includes working at PwC, Deloitte, and Novartis. Her academic background includes obtaining an MSc in Digital Currencies and Blockchain Technologies from the University of Nicosia, graduating with a cum laude, and focused her research on giving ownership of data to patients. Georgina is the CEO and co-founder of Aria Health. Aria is a platform that transforms patient experiences with the healthcare system by leveraging the benefits of blockchain technology. It allows patients to have access, understanding, and engaging with their medical records, but also connects all relevant stakeholders in the healthcare industry together on one platform. Aria democratizes the availability of medical data and the fair distribution of financial rewards. So, Georgina, so nice to have you with us today. Thank you so much for accepting the invitation to discuss this fascinating topic, DeSci. So I speak a lot about decentralized finance, DeFi, but never about DeSci, decentralized science, which is actually a term you taught me last time we spoke. So thank you for joining.
Thank you. It's a pleasure to be here.
Perfect. So last time we spoke, you had a very, very interesting story of how and why you got into Web3 and blockchain technology, and sort of what led you on this journey. Could you kindly retell this story for the listener, please?
Yes, of course. Yes. So I started my kind of journey in the blockchain and decentralized world nearly over 5 years ago now, actually. I did my master's in blockchain with the University of Nicosia. I was working with them at the time, and at first started sort of to learn about the topic to see how could this apply for the accounting and the professional world, which is the world I come from. And then I just got fascinated by the whole concept of mainly decentralization and what that could mean and how that could change the way we interact in the world. And so I did my master's in this, and as I got to my thesis, I was working with a friend and now co-founder of mine, Fadi, and we were discussing, okay, well, what should we do our topics on, my thesis topic on, and the usual is, like you were saying before, DeFi, although that wasn't a term back then, but finance, supply chain, many interesting topics. And then at sort of literally the same time as we were discussing this, his wife was rushed into hospital and she was in agonizing pain, and she was made to wait for more than 4 hours while they frantically searched for her medical data. And it was really just by luck that a doctor that knew her came by, took her for an ultrasound and found she had an ectopic pregnancy. And even though she'd given birth in that hospital 2 years beforehand, they didn't even have the details of her gynecologist on record. So they, basically called him up on the mobile. He rushed in, took her through for surgery, found she'd lost 3 liters in blood. Thankfully, it was okay, even gave birth to another baby a year later. But it was really that kind of triggered us to say, we have access to so much information and not to our most important data, our health data. And then at the same time, we're studying this fascinating technology, which is all about giving ownership back to the true owners of data. And, in those days, it was more financial, but finance is really just another type of data nowadays. And it's focused on privacy and security, which is even more important in the case of this sort of data. And so this is really what led us down the route to looking into this. And as we looked more and more, we saw that this data is driving healthcare forward. And the only way we can just discover new medicines or understand an epidemic like COVID or bringing new health technologies with AI and machine learning is by having access to this data, and we really want to sort of enable access to this information in a way that empowers the patient and brings transparency and fairness to the industry.
Amazing. Thank you for that. So you sort of saw a real market needs, and that's why you have such an amazing product market fit. So enabling access and really giving ownership back to patients at the end of the day. Can you please give us an overview of what Aria Health is all about, sort of how it works and what the benefits are that Web3 and blockchain bring to the project?
Yes, so Aria is a next generation healthcare data platform. Essentially, what we are doing is we start by going to hospitals, and in the future, this could be also wearable devices or health tech applications, and we integrate with them to be able to get patients to have automatic access to their data. The patient then has a mobile app, so we have the Aria patient app, where they can download the app, they create their blockchain wallet, we make it very simple, none of this crypto native needs, just simple account process, getting your private keys, and then you can request your data. We then have that process which automatically extracts all that data into the patient's private blockchain wallet. It's encrypted so that only they can access it, they can prove it belongs to them, and they can view that via the platform as well. So we also try and make that information more engaging and understandable for patients. And then what we do is we give them the options to share that data. So they can share that to doctors for second medical opinions, if they're traveling abroad, for any reason they need for that, their own personal health outcomes. But they can also choose to allow other parties to access that. So, for example, researchers studying, a rare disease, and you want to contribute your data to be able to have them understand that disease better and move it forward. So we then give them the option to control that and choose how that data gets accessed. Then on the other side, we allow, whether it's a university, whether it's a nonprofit organization, whether it's a pharmaceutical company, to be able to access that data anonymously and be able to get large amounts of data to be able to advance their research forward. Where they pay for that data, which they normally now are paying for that data back to the hospital or to the health tech platforms. You hear stories like 23andMe, they've sold 10 million DNA records to GlaxoSmithKline for $300 million. We now are wanting to bring the patients back into that. So they actually execute a smart contract, which then distributes the payment back to the patients and to the hospitals and to anyone else who was needed to get that data to where it is. So sometimes we have parties that need to clean the data or add extra information to the data. And we really are looking at, this is where blockchain is so ideally designed, aligning those incentives and bringing full transparency. So the patient earns, they decide who accesses, and they can track at all times who's accessing my data, how's it being used, change their mind, revoke access, and also just generally get more of an understanding of what's happening in the industry and how things are progressing forward.
Amazing. And that's such an amazing use case as well. So basically, a patient would download their wallet, you said receive the private key, so they would be in control of their private key, so it's sort of a non-custodial solution, and then decide what they want to do. It could be they just want to access their records, it could be they want to use and monetize on the data, so you said you have certain third parties who are integrated within the platform. So in relation to this, can you give an example of a hospital that you're currently working with, if you could mention any names, and perhaps also any key partners or stakeholders who are integrated for some of the use cases you mentioned, such as monetizing your data?
Yes, of course. So we already have, we're already up and running in 2 hospitals, the American Medical Center and Aria Polyclinic. This is based in Cyprus, where we are currently running all our pilots and our proofs and concepts. So that's, we've got more than 7,000 records being transacted, got patients every day downloading it. So it's really awesome to be able to see a mainstream use of blockchain. I mean, we've seen that it takes less than 5 minutes for a patient to create their blockchain wallet and access their data. And we have less than 2% of patients needing any help from ourselves or from the hospital. And so we really like making this a real sort of mainstream platform. We then are now working with Novartis. So we have we were part of the Challenge EIT. It's a special program that Novartis run for a very sort of few select startups in Europe. So we've been working with them really as a design partner of the marketplace, but also now to run further pilots with. And we can't mention names now, but we have a very big hospital group who we're just starting the pilot with, and I think in the next month we should be able to announce officially that they are a public listed hospital group who are in more than 4 countries in different continents and have literally more than €1 billion worth of medical data. And I think what's amazing with working with them is they're really excited about the use case of being able to empower their patients. They get kind of the benefit that, yes, great, they can earn some money from this, but rather than doing it in a way that sort of goes against the patient needs, they do it with the patient. They're empowering their patients, giving them an opportunity to control and make the decision making while also benefiting themselves. So yeah, there are quite a few others in the pipeline, but yeah, I'd say those are the ones we can talk about now.
That's amazing. I mean, 2 hospitals and 7,000 records, and you said less than 5 minutes to just open a wallet and sort of use the app. That's really, really amazing. And as you said, it is a brand new concept, especially in the medical industry. I imagine that usually these players are used to operating within these gated walls and really controlling and owning all this data. And it's quite a new concept, I think, to enable patients to actually use and leverage and monetize this data. So that's really exciting. And I'm 100% sure that it's going to just grow and boom. And I don't see why market participants wouldn't be interested in partnering up. And what really fascinated me about your product and some of the material you sent over when I had a look was the financial benefit. So you said that you could help patients monetize their data, and you offer some financial incentives. So it's sort of applying the concepts of staking and rewards, but also to patient and medical data. Could you elaborate a bit or break down the part in terms of how you offer incentives and rewards, and also the percentage of distribution between the market players?
Yes, of course. Yeah, so we use a mixture of stable coins and our own Aria token. And depending on the market participant, particularly whether they're more crypto native or less crypto native, or depending on their regulatory situation, they will interact with different pieces of that. As I think I've kind of made clear, we're really focused on creating a mainstream application and not something that's going to be limited in use. So that's very important for us. Now, when it comes to the revenue distribution, so as I sort of mentioned, effectively in simple terms, it's a revenue share. So when let's say, researcher purchases data, then we split that. Normally 10% goes back to the hospital, and then up to 25% goes back to what we call the data aggregators. So those people that need to curate the data and sort the data and add extra value to the data, but it depends what work they need to do. Some goes back into the protocol and running the network and making sure it's secure, etc. And then around 60 to 70% goes back to the patient. So it's sort of very patient heavy, while still making sure that the parties which need to be involved in order to make this data valuable are also incentivized. We then also have staking opportunities. So we have parties who stake on the data sets to show the quality of the data. So it's really important for us that we can showcase to the different data buyers which data sets are high quality and should be purchased, and then the stakers get also a part of that revenue. Another feature we have is to be able to offer bounties. So let's say you're a patient advocacy group for a rare disease, and often in the pharma industry, for example, there's more time and attention spent on profitable illnesses, which are more common, like in dermatology world, that could be psoriasis, that lots of people have, and the rarer disease kind of get left behind. And part of the reason they get left behind is there's often not enough data to actually do the work. And so we give the opportunity for people to actually put tokens down as like a bounty and say, kind of hold their hand up and say, we really want this topic researched and attention given to it, and we're willing to put some money down to encourage people. And that,
I love that.
incentivizes aggregators, researchers to really get involved. So, yeah.
So if there's like a rarer disease or medical condition that you really need to research or data for research, then you put this bounty out and sort of how is it like an alert on the system or a platform? Is there like a section, like a bounty section, or how does it work?
Yeah, exactly. So there's as part of our platform, there's like a section which sort of shows health trends and health interest, and it gives some signals to the, let's say, researchers to say, okay, these
That's
ones
so cool.
for them, or these topics are really staked on, so people are really interested in this, and so it's also really trying to signal to the
amazing,
to the, direction they should go in.
And that's quite a cool concept. And if I had to just go back to the underlying technology, could you elaborate a bit on the type of blockchain? So it's private, public, permissionless, and also some considerations that you give for, let's say, privacy or identity or security.
Yes, so we have actually various different parts to our system. So we have a blockchain, we have decentralized storage, and we have a zero knowledge management system. So the blockchain itself is a permissioned blockchain, although we leverage some public blockchains to help our security. And we're part of the Polkadot ecosystem. And there, as I mentioned before, the patient themselves is the one that generates their private key, and that they encrypt their data with that key. So that's really where the privacy aspect comes in, that they are the only ones that can get access to that data. So the data itself is encrypted and stored on the decentralized storage system, but that can only be accessed and controlled by the patient. There was, I think, a second part to your question.
I said sort of considerations for identity. So I don't know, like verifying the identity of the patient before giving access to the records, security, and the type of blockchain you want. So just maybe the identity part would be interesting.
Yeah. So what's something that's really important for us is making sure, it kind of comes back to the privacy. So the data actually stored in the decentralized storage is actually anonymous. So we take off any names, etc. So even if it got access, to which it wouldn't without the keys of the patient, it still would be anonymous data. So what we do is when the patients register to our app, they give us their very minimal information, so their name, their date of birth, their gender. They put that in, and then when they request that data from the hospital is the one that does the verification. So they already have, the patient's already been to the hospital, created their account, and verified that information there. So what the hospital then does is they check the information which is on our system to the information on their system, and that's a form of verification.
Okay. Is there any like biometrics for verification or something like that?
We not biometrics. We do OTPs and multi-factor authentications as part of that. But otherwise, it's the core demographics. I think what's interesting is that the more a patient connects to different hospitals, you get this like multiple independent
multi-layer.
Multi-layer and multi sort of security reviews of that data, so that identity ends up being like a decentralized identity as well, because you have all these independent parties who have each met the patient one-on-one at some point.
Yes, it would be good if they can all rely on each other. So instead of duplicating the process, it's just sort of wrapped and then can be passed on after it was verified from the first source, let's say, something along those lines. Could be like a next progression or
Yeah, exactly. I think that's really interesting. Yeah, definitely share that. And I think in the future, like so far we've discussed more like uses of the data for anonymous reasons, like for research, but if, for example, in the future it was used for insurance claims, and automating insurance claims, that would be very important that the actual identity of the patient is verified. And so for an insurance company, they'll be able to feel much more confident. The more hospitals you've connected with, the more confirmation of your identity there's been. So where it is a case that we need to know the person, or for example, they were going to be on a specific clinical trial and they needed to show their personal data, and then it's a really nice kind of method that you've had so many different hospitals verify that person's identity.
Of course, because obviously, since we're speaking about medical data, the identity and the security are sort of even more, essential when it comes to this platform. And speaking about risks and security, are there any types of risks or abuses you foresee in this type of industry? So, for example, I don't know, market manipulation by pharma companies is like sort of a common one that people would think of. How would you mitigate, certain risks associated with, let's say, market manipulation of pharma companies in terms of being integrated and using your platform?
Yes, so I think if we talk about market manipulation and more like sort of price manipulation, and we purposely have a party in between called the aggregator, which I kind of have mentioned in the past, and this is the person which sort of gathers the data and creates the data sets for the pharma to buy. Now, they also sort of sit there as almost like a market maker, so they set the price for the data, and they are going to take a percentage of that price. So they want that price to be as high as possible, which is also what the patient wants and also what the hospital want. But of course, they need it to be low enough that the farmers are going to buy it. So this means that we sort of enter into kind of a natural market supply and demand situation where we can make sure that the price is actually fair, and data pricing is a subjective topic and a problem throughout the industry as to knowing how much data is worth. So that's sort of the one method. Now, as we gather more data, we will be able to start doing more, for example, machine learning techniques, and be able to start analyzing what is a fair price, depending on the type of data, depending on the quantity of data, depending on the curation of that data. And so that's definitely, as we grow and we get data about how the system is being used, we'll be able to bring in some really interesting techniques to analyze and make sure the pricing is always fair and efficient.
Okay, amazing. So would you have sort of then a human element at the moment to cover these type of analysis or assessments in terms of what is, the fair price, and can it be offered like this? Or how do you control it right now?
Yeah, so right now it's this aggregator is a human. Basically, it's an independent party who themselves will be able to assist. So we have parties who are experienced in the industry who are doing this sort of as a norm, and that's how they earn their revenue. So that's why I said like their incentive is the price to be high.
So they would be like the aggregators within this chain.
Yeah.
Okay, perfect. Okay, understood. Amazing. Yeah. Okay, that's really fascinating. And if I had to just sort of close in terms of what is next for Aria, like what exciting projects or partners or programs you have lined up or projected in the next few months?
Yes, so we have, as I've alluded to, we have a big partnership coming up where we'll be integrating much larger amounts of data and a high number of patients coming on board. So that's our next project. We have some really interesting, let's say, use cases related to NLP and AI machine learning, and assisting specific parties with accessing data for improving those solutions. So I think that's going to be really interesting to see how that plays out. And then we also have partnerships with farmers coming, where we'll be looking at analyzing the effectiveness of different medicines and how to ensure that people are getting the most effective medicine. So through those use cases and pilots, we'll really be able to prove out our system. And really what we're excited about is, the patient involvement. So another thing that we're now adding into the app is the ability for the patients, the farmers, for example, to communicate with the patients, be able to tell them, like, you contributed this data and great, you earned, but this is what happened, this is what it led to, this was the results, this is the progression, this is the impact, and really have a focus on impact for patients.
Amazing. Amazing. I'm not really ingrained in the MedTech industry as much as you, but are there any other Web3 similar projects and platforms offering the, similar solutions?
So DeSci, I'm glad to say, has become suddenly more popular. I think with COVID, we've seen a big increase in health tech. We've seen a change in the culture of the industry, being willing to open up to new innovation. So there are other Web3 health projects doing different activities, like the project called Molecule, which is about getting investment into research projects, and people who invest in the project get a bit of the IP of the let's say developed drug. And yeah, so there's some different sort of DeSci projects which are interesting. We've seen some other solutions, focusing also on health data exchange. So there's definitely more and more. All each coming from sort of different angles, and it's going to be exciting to see how we all come.
No doubt. And also, I actually wanted to ask you this before. Is your token listed and being traded on any exchanges right now? Or do you have intention for it?
So far we stayed away from actually using tokens because we were focusing just on the data management.
Because you said you have your own native Aria token, which you give as rewards.
Yes. Now we've just introduced the Aria token. It is not listed yet, so that's new to our system. But I'll let you know when it's ready.
Amazing. Okay, thank you. So that was honestly a fascinating discussion, and for me a breath of fresh air, because we focus on regulatory and finance a lot, so I've learned a lot myself personally. Before I let you go, I'd just like to invite you for a round of I Call Bullshit. So I'll read out a statement or a fact and just tell me if it's bullshit, so if it's false, or it's not bullshit if it's true. So according to an article published on January 10th, 2023 on Business Wire, the worldwide blockchain technology in healthcare industry is expected to reach 1 billion by 2028. Do you think that statement is true? Is that figure correct or inflated or not?
I know that there was an article recently about this, and I think it's actually true. So I think it's true.
Okay. So it's actually bullshit, but for a positive reason, because the figure is expected or projected, because these are projections, to be 5.3 billion by 2028, not 1 billion. And these use cases vary from collecting and accessing patient data, similar to what Aria does, but also supply chain management and data exchange.
Yeah.
In a broader way. So good news. Then it's just gonna boom. So Georgina, thank you so much for joining. It's been a real pleasure. And to you, our listeners, thank you for tuning in. If you enjoyed the show and our episode, please like and share our podcast and subscribe to our newsletter. Lastly, we are very pleased to announce that during the next episode, we will be launching our regulatory mini-series focusing on MiCA, DLT pilot regime, and CARF. So stay tuned, and until then, take care.